Hi, in this video lecture, we're going to take a look at chapter 21, the rest of it. So how do we measure your pulse and blood pressure? Right, you can probably do this easily at your doctor's checkup, and you can also do this manually. So we can find two major arteries, for instance, our common carotid artery over here, as well as our brachial artery. So once you find them, don't use your big thumb because it has its own pulse. Use your other fingers, press on it, and times how many pulse you count for each minute. So at rest, our normal pulse rate is about 70 to 80 beats per minute. Now for individuals whose pulse rate is higher than 100 beats per minute, we call those tachycardia. Tachy means fast. And if it's the opposite end, bradycardia means for those individuals whose pulse rate is lower than 50 beats per minute. And we see this a lot in endurance-trained athletes, that their heart is working more efficiently than normal individuals. We can also use a sphygmometer to measure blood pressure. So using, for instance, this manual measurement, you can take a look at the pressure and by listening to the sound. Now first imagine if you have a river. Okay, so imagine this river is flowing through here, and if there's nothing in the river, no branches, no nothing, you'll hear no sound. But if you have trees that fell off or there's a big rock, then you're going to hear perturbance of the water. So for listening to the blood sound, it's the same too. So when you actually put on the cuff, we increase the pressure in the cuff to about 30 millimeter, a little bit more than ours, and then we actually try to let it release. And that first sound that you hear is when your heart is contracting and the blood is actually spewing out of the site. So that's our systolic pressure, usually around 110 to 120. And you'll keep on listening till the last sound heard. So that would be your diastolic pressure, usually around 70 to 80 millimeter of mercury. Okay, so you can definitely do this manually and listen very hard to the first sound as well as the last sound. Now, we have heard a lot about hypertension related to very high blood pressure. Let's take a look at our normal category. Your systolic would be less than 120 in general. Diastolic is less than 80. We call it would be pre-hypertension if you're in the range of 120 to 139 millimeter mercury, or about 80 to 89. And if you get to stage 1, your blood pressure is even higher. If you get to stage 2, hypertension, your systolic is greater than 160 and diastolic is greater than 100 millimeter mercury. So why is this so serious? Right, so take a look over here. Now, there are a lot of reasons why hypertension is very serious. First thing, with the high blood pressure, your heart has to work extra hard. So first thing, your heart is working extra hard in order to pump all the blood through the vessels. Now, all the high blood pressure is not that great as well because it can increase chances of plaque formation inside your blood vessels. And if we go up to our eyes, our retina is actually very, very thin, delicate layer of cells. So they may cause hemorrhaging of these very thin layer. And it might cause a stroke if these plaque were to travel to different places in your brain and stop blood from flowing. Now, if we go further down into our kidneys are under high filtration rate. So these are under our kidneys tend to suffer kidney diseases as well because of those high blood pressure. and possible aneurysm as well. So hypertension is very serious. You should always pay attention to your blood pressure and hope and take good care of your body so that you can live for a long, long life. Now, on the other hand, how about hypotension? Is it serious? We say this is about if systolic is less than 90 millimeter mercury and diastolic is less than 60 millimeter of mercury. So usually for normal individual, this is not very serious, not a disease. But if it's for patients, this might be very scary for a patient who might have heart diseases or so, then this will mean less oxygen that are being supplied by the blood into different parts of tissue. So it is different for different individuals. Okay, but if you're healthy and you're very athletic, then in normal people, this actually means that you're in pretty good health and fitness. Now let's take a look at the type. When we do lose have blood loss, we will suffer a symptom called shock, and our body is going to try to compensate for that. Now we have 4 basic type of shock condition, and this is when, for instance, we might have a low volume, meaning hypovolemic shock, so due to loss of blood fluid. And this could be due to different reasons. For instance, a patient might have blood loss or because of diarrhea or less intake of fluids. So all of these could lead to a serious case of shock, or it could be a cardiogenic type of shock because due to poor heart function, or obstructive type of shock, meaning it could be something that's obstructing the blood flow, and a good example is a blood clot. Vascular shock is actually due to improper type of vasodilation. So you might have heard of anaphylactic shocks, which is similar to allergic reactions, okay, to a bee sting or so. That relates to releasing histamine that actually causes vasodilation, or septic shock is another example as well. So all these different type of shock characterization always end up with, for instance, less blood pressure, as well as sometimes less blood flow. So your body is going to try to compensate for this. For instance, what do you think will happen to your heart rate? Right, your heart is going to try their best to compensate for it because your blood pressure and blood flow has dropped. So they're going to try to increase your heart rate, and they're going to contract more forcefully. Now, our autonomic nervous system will also try to kick in. They will either, depending on the type of shock, either to undergo vasoconstriction or mild consideration of vasodilation. Now, ADH will be released because this is usually sensing when you have less blood volume, less blood pressure. So they will try to be released and help you conserve water. How about renin? They will be released as well, angiotensin 2 and etc. Ultimately, aldosterone is released to help you conserve sodium. When sodium is conserved, water follows. And in this case, you want to make sure you inhibit the AMP, which is the atrial natriuretic peptide. Okay. Now here's an overview from your slide in your textbook, which goes through similar things as well. So you can go through and follow how your body actually try to compensate. If you have a drop in blood volume and blood pressure, both receptors will respond to it, and ultimately your factors affecting adrenal cortex, releasing aldosterone, Kidneys conserve both water and salt. Blood vessel constricts, and heart rate works much faster. So all of these trying to increase blood volume and blood pressure to return back to normal if they could. Now the next very important topic is the different type of circulatory routes. So we have a major systemic circulation. As we say, all the blood flows to all regions of the bodies. So we'll take a look at that, and we'll take a look at some subdivision as well, the cerebral circulation to the brain. Coronary, where does it go? Is it to the kidney? No. So coronary to the heart. How about hepatic circulation? Hepatic means your good old liver. Right. And pulmonary circulation are going to our lungs. Okay. And we'll take a look at very special circulation, which is the fetal circulation towards the end. So first, when you're studying the systemic arteries as well as the veins, focus on the names, okay, as well as the region that they supply, if it were the arteries or if it were the veins, which regions do they drain from, and as well as right and left, okay, if they are paired. Okay, now so first let's take a look at some circulatory route. So just to start from your heart again, okay, everything will drain into your right atrium, and it goes through the right ventricle, out into the pulmonary trunk, into your lungs. So once they gather more oxygen, okay, carried by your red blood cells, it goes back into the pulmonary veins, which are red, very oxygenated, goes back into your left atrium and left ventricle. You'll see your left ventricle has the most powerful myocardium as they try to pump all the blood through the aorta, the ascending part, aortic arc, and the descending part of it. And from here, it goes to the rest of your body. So we'll take a look at all regions. Okay. And here's a diagram of a lot of these arteries and veins that we will take a look at. First, the arteries. So let's take a look at aorta and its branches. So first, coming from your ascending aorta, okay, so imagine, your left ventricle pumps the blood through your aortic valve, the semilunar valves, to the first part. Now, here it branches off quickly into the coronary artery. Okay, so let me get rid of this first. Okay. So here is your right coronary artery, and here is your left coronary artery. So your right coronary artery is going to separate into two branches. One is the marginal branch at the front, and it loops back to form into the posterior interventricular branch in the back. Now the left coronary is going to branch into the front, so we call it the anterior interventricular branch, as well as the circumflex branch in the back. Okay, so we have seen this before, and here's another view when we talk about the heart. Okay, so I won't go into too much detail. Now, from the arc of aorta, we have very important branches of artery. So let's take a look over here. One question to ask is, how many major artery branch from the arc of aorta? Right, so from the arc, can you count how many? Right, here's one. Oops, I don't want that. Here's one, which is your brachiocephalic trunk, and that supplies the right side of the head as well as the trunk. Now we also have our left common carotid right here, and your left subclavian. Okay, so how many major arteries branch from the arc of aorta? Right, 3. Now if you ever were to take a look at fetal pig, they're going to have just two, and they're actually missing the left common carotid. Okay, missing the left common carotid artery. So it's just for your information. Don't worry about this on the test for the fetal pig. But I want to take a look over here. Now, from your brachiocephalic trunk, it branches now into the right common carotid, you can see here, and the right subclavian. Okay? So from here on, everything will be symmetrical to your left common carotid and left subclavian. So you'll see also a right vertebral that's going to go through the vertebrae in the back. Now from your right subclavian, it's going to go through your armpit. So what we call this artery as it goes through your armpit. Right, so don't forget your regional name. So bring back some fond memories of your regional name. This should be your right axillary artery. Okay? And as it goes through the front, we call these upper arm or your brachial. So this is your right brachial artery. Okay? And let's follow through. And remember your two bones, forearm bones. You have your right, is it ulna or radius? Right, this is the right radial artery and the ulnar artery. Okay, so if you remember your bones, if you remember your regional names, you should be all right with a lot of these names of the arteries. Okay, now here's another one over here, taking a look at a right lateral view of their branches from your brachiocephalic trunk. So here is your brachiocephalic trunk. As we said, it goes into your right common carotid, okay, here. Now, and also we have our right vertebral, which we didn't see a lot of it earlier, but it goes through your cervical vertebrae and your right subclavian. Now, from your right common carotid, it will branch into two. So we have a right external carotid artery over here, and then the inner one is your right internal carotid artery. And you'll see that the supply regions of the face and to your temporal region and occipital regions, okay, for the vertebral artery. Now let's take a look at this one, which shows you a cerebral arterial circle, and we actually call this the circle of Willis. Okay, and this reminds me of the movie where I guess Tom Hanks was in. There was a little ball that called, I guess it's not Willis, but close to it. Anyway, the little volleyball. Anyway, it reminds me of it. Now here is our vertebral artery. If you follow through, it actually branches into several branches. So we have our posterior cerebral right over here, and you have these communicating arteries. Okay, the posterior communicating ones, and there's the anterior communicating ones. Now this is very important because this circulatory of blood vessel is so important. Imagine if you have a blockage over here, so blood cannot flow through the blockage. But how can you get to this side of the brain then? Right, this is encircled. So blood can still be able to go through an alternative route to supply different parts of the brain if it did happen to have a block over here. So this is a very clever way of protecting regions of the brain using a circulatory type of blood traveling through the brain. Now here is a scheme of distribution. So for instance, starting from the arc of aorta, so don't forget we branch into 1, 2, 3. Okay? And from your brachiocephalic trunk, it goes into the right common carotid and right subclavian. From here on, everything will be symmetrical. Okay, so even though it's only listed one here, right axillary, right brachial, right radial, and right ulna, you'll see the left the same thing as well. Okay. So let's take a look at now your thoracic aorta. Okay. So there's a lot of here, but only one I want you to know is that as it descends through the thoracic regions, your thoracic aorta is going to support lots of organs, systems inside here as well. So we'll take a look over here to see some examples. For instance, it's going to support our regions in your thoracic region, to the heart is pericardial regions, brachial region, esophageal, for instance. But don't worry too much. This is the only word I want you to know, the thoracic aorta. Now, abdominal aorta, we're going to take a look at some that are unpaired. This is just by themselves, or that are paired types of arteries. There are two of them. So let's take a look over here first. Okay, the unpaired ones, I've colored them in red. So for instance, starting from your first unpaired one would be the celiac trunk that separates into other branches. And we also have our superior mesenteric artery. And let's take a look at where they supply in a moment, and the inferior mesenteric. Now, other ones, at least several important ones you see, for instance, the renal, you will have left as well as right renal because your kidneys are going to be around here. Now you also have right and left gonadal arteries, so either testicular or ovarian arteries. Okay, so let's take a look at their branches. So first of all, from your abdominal aorta, you branch into the singular celiac trunk. So from the celiac trunk, it supports different regions. So, but don't worry too much about it. But I don't want you to memorize all these. But there is definitely just one celiac trunk, supply region of your stomach, spleen, and liver. We also have our superior mesenteric. So right over here, is your superior mesenteric, where they supply parts of your small intestines, jejunum, ileum, and first half of your large intestine as well. Now, take a look first at our inferior mesenteric. If we take a look over here, support and regions of the rest of the large intestines. Okay. Now, other parts that we say are paired are our suprarenal, this is going to our adrenal glands, and renal, definitely going to your kidneys, and gonadal arteries as well. Okay. So, this top one is our celiac trunk, forgot to mention. So it supports your spleen, your pancreas, and parts of your gastric region. Now let's take a look at the arteries of the pelvis and lower limbs. Okay. So from here, our abdominal aorta continues to branch off like a river. So first into right and left common iliac. So over here you will see the anterior view of the right common iliac, and you'll see part of the left common iliac. Now right over here, it branches straight into right internal iliac, which is this one, and the external iliac. Okay, and the external iliac will continue to flow through your femoral region, so we call it the right femoral artery. And as it passes through the backside, it's the right popliteal. Now, one very important region is our femoral triangle. If you take a look over here, this triangle tells you this is a site, for instance, we have very important femoral arteries, okay, as well as nerve and veins that goes through here. So, and this is the site, if they were to put a catheter through here, the catheter will be able to follow through all the way up to your back to your inferior vena cava through the femoral vein and get back to eventually to your inferior vena cava and to the heart. So this is quite an important region, your femoral triangle. Now let's take a look at the scheme. So make sure you know from your abdominal aorta how it branches off to right and left common iliac, and then branches into external and internal iliac, and to femoral and popliteal as it goes on. Okay. Now, how about your veins? So let's take a deep breath first. Okay, so your vein has a lot of important job as well because it's going to carry all the waste and everything. So, for instance, we're going to take a look at